You want to process all your trauma in life on camera?
Not really, but kind of. Okay, so basically, I was sitting here talking to Peter, and I was like, well, if part of my mission in life is trying to share my experience in order to help others who are processing similar but different things in life, then we should probably just finish the processing on camera. Basically, the last 6 months, I've mentioned this, my port has not been working right. Sometimes it doesn't work at all, sometimes it kind of works. It's worked well enough, like I've gotten through the past 6 months with only needing a peripheral IV once or something like that, but...
It's been reliably sluggish. Right?
Very sluggish, like almost not humanly possible to flush, but then it flushes, but then it's like, anyway, it's just been bad. And honestly, this port has been bad since the start of its life. It's been super positional. It has infiltrated the needle approximately 8,000 times, meaning the needle slips out of position because of the placement of the port. If I reach forward, the needle can slip out, etc.
Yeah. I still remember the conversation we had with the surgeon before they placed the port, and Mary was like, I think you wanted it like mirror image
Yes.
to where your old one was. And the surgeon was like, well, if I put it over here, it's more hidden and you can...
The first thing was they decided to use my same access
That's
point.
true, yeah.
That was the first and biggest reason.
But
then secondarily.
But the point I'm making is the surgeon's priorities are not the priorities of someone who lives with a port. And the surgeon was thinking about like, look, if we put it here, you can conceal your port more. And for some people that might be like an important factor, but
for me,
for
it's all
Mary,
function.
it's like if the port's not gonna work well, anyways, don't put a port in your armpit.
So that being said, it has served me for however many years it's been, which I can't quite figure out. I'm so confused. Was it 2017?
It was...
Yeah, it's about 5 years, I think.
Which is a reasonable amount of time for a port.
It is. Some people were surprised that my first port lasted 10 or 11 years, however long it was. Some doctors or nurses were like, that's super long. Yeah. Other times they're like, oh, it should last longer than 5 years for this one, but it is what it is. Like, I can't control how the port's working. Anyway, all that I'm saying is I got an email this morning. So the most recent issues have been when I was in the pre-op area before my endoscopy, and the nurses were like, this port is not working well enough to send you in for anesthesia. It turned out that the anesthesiologist came in and he felt comfortable enough with it. He's like, let's try it. It worked, it was fine. But that was one issue. And then just a few days later, I had to be accessed again for IVIG or, no, was it for Vyepti? For an infusion, whatever it was. And again, the nurses were like, this is really bad. I don't think it's gonna work. And I said, if it's through a pump and not gravity, it should work. And we kind of went back and forth. It worked fine because it was through a pump, but it kind of makes people nervous. Like, I should be able to flush this. We tried TPA, that did not work. It actually made it kind of worse. I don't know how that's possible. So then my cystic fibrosis team is talking about how do we get this port to work? And that comes in where we were processing. Basically, The way that they do it at this hospital is in interventional radiology. And basically, you go to IR, they plan to strip the line, which is super intimidating because I'm like, how big of a cut are you cutting in me? Where's the cut?
My assumption for stripping the line would be they'd just access your port with some kind of needle that can run a wire through it.
But it's a metal plate.
But some...
Or go through the rubber?
I have no idea how they do it.
I get the sense that they cut you open, detach something, and strip
and then
it.
Run through the line. I don't know.
This is all coming from 30, I don't even know how old I am. Am I 32, about to turn 33, I think?
I don't know.
Yes, 33.
Yes.
Okay, so I'm almost 33. It comes from almost 33 years of experience where they try to place PICC lines when I'm 11, 12 years old, and my veins won't let it go in, so then they have to put me under anesthesia to get a PICC line in. And that was with light sedation. They tried. They walked me down the hall. I remember crashing into the OR bed, and then they put me out. They got the PICC line in, no problem. They never again tried to put a PICC line in when I was under light sedation. Okay, fine. That's good. That worked out. Then I got my port. Great. That worked out. I was put completely to sleep. It was not light sedation. Hey, bug.
All that to say, I think this is something that, and maybe, I don't know that we've talked about it a whole lot, but I think with chronic illness, with life with cystic fibrosis and probably a lot of other chronic illnesses, there is medical trauma from procedures or experiences that has to be relived and revisited often because, well, and here's the thing, a lot of people have medical trauma in their life, but they don't have to revisit it, you know? Like,
if it was like a one-time thing.
Yeah, like you break your leg or whatever, or even like, I don't know, some kind of procedure that's a one-time thing.
Yeah.
And but like in chronic illness, that trauma is just like another procedure has all the trauma moments of.
Yeah.
And I think you have a plethora of medical personnel who have had different kinds of bedside manner or not so good bedside manner or harsh nurses or that sort of thing that feeds into, like when you have a one-off, you can write off that not nice person as like, that was just a not nice nurse, but like when you have it throughout your life. Anyways, I don't want to speak for you, but I'm just interpreting what I
all
hear.
The inaudible things I'm
what I hear from Mary as she's thinking about going into interventional radiology. It's not really like that itself. It's just all the past experiences and...
Yes. And I think that's what I was going to add to what you said is it is 33 years of past experiences that leads into this. So it's not just, oh, you're going to go under twilight sleep or conscious sedation and they're going to cut you open. So basically, my understanding of what will happen or what may happen is I go into interventional radiology, which I've been to before for port studies where it's just normal accessed port, put radioactive liquid into it and see what the line looks like. They apparently don't do that at my hospital, but go to interventional radiology. Apparently they're going to try to strip the line, and if that doesn't work, they're gonna remove and replace my port. But the reality is they're going to dig out a medical device from my armpit muscle that's been in there for half of a decade, and then they're going to place an entirely new one while I'm awake.
Yeah. Here's, I think part of what goes into this is our experience, at least this is my perspective on interventional radiology, is they're very, tend to be very like matter of fact.
Very
like,
pragmatic.
Very pragmatic in their approach to, like, so we've dealt with interventional radiology with feeding tubes in the past. But okay, oh shoot.
I forgot about that.
Should not have brought that up. But here's where it comes in. We can't even get a hold of interventional radiology on the phone. I don't think they usually talk to patients beforehand for the kinds of things that they do, and that I think is a problem, because this isn't just like them performing maintenance on a medical device. This is a part of Mary's body and her life for the last, this port for the last 5 years. But, you know, she's had a port for 16 years, and she has more experience with this than anybody else. And interventional radiology often approaches these medical devices like, you lay there and we'll take care of this.
Yeah, and we'll replace it. I'm like, this, like, it feels like, oh, good thing I have my receipt, and it'll be just like a painless, what was it? Like, yeah, replace the broken one, no problem. But it's like, oh, you're digging in my actual chest for this, like,
Yeah.
yeah. So the other, I mean, there are a lot of different experiences that come to my mind when I think about this, but one of them is also, I moved to Boston, or not Boston, no, Chicago, the week I turned 18. So as a teenager, I'm in this new city, and I'm at a new hospital, which at that point was my first new hospital. And learning my new teams, at that point, I think I only had a cystic fibrosis team and now a liver team. And I met the new liver doctor. She was super nice. She's like, we need to do a liver biopsy and an upper endoscopy. So the liver biopsy, I was partially sedated for, but I remember every second of it. It was fine. It was fine. I remember feeling odd. You know, it's a weird feeling. I remember being drugged and being like, can you show me where before you stab it? And they're like, sterile here. And I'm like, Anyway, so then I go in for the endoscopy, I don't know, months later, weeks later, I have no idea. And they tried conscious sedation. I knew nothing. I didn't know what these medications were called. I had never, well, the PICC lines, I suppose. I suppose I didn't think to tell them they tried conscious sedation on me to put PICC lines and it didn't work. I didn't think to tell them that, apparently. And so she ended up, if I remember correctly, using fentanyl and Benadryl. Needless to say, it didn't work. I was completely awake for the entire upper endoscopy, which if you've ever been awake for, it's a tube in your throat. It makes you feel like you can't breathe and you're gagging the whole time. That may have been a CF side effect because I was probably coughing and gagging the whole time. I don't know. But she was, I remember her, well, you were in there for part of it.
It was awful.
Was it?
Yeah, well...
So now you have trauma from it?
I do have trauma from that.
Really?
Well, because I don't know why, but basically I went back to the procedure room. I don't know why that happened, but
well,
then...
I think I wanted you with me, because as a pediatric patient previous, my mom always came back when I went to sleep.
Yeah, and so I went back, but like, basically... It was like Mary wasn't going to sleep, and I think the doctor was like, we just have to get started.
They go, I remember them saying like, Mary, go to sleep.
Yeah, oh, it was...
I was like, I'm trying? I don't know what?
Not good.
Oh, I didn't know that was like...
It's not traumatic, but I'm like...
You literally just said it was. We're still processing.
It was, I don't wish to go back with you for when you go to sleep.
Typically it's like this. Like I'm like already out of it, and then I just go to sleep. That's the only time that's ever happened.
I think it was the drugs. They were just using
insufficient.
Yeah, Benadryl and
Fentanyl. I think. So I learned from that experience that those two drugs don't work for me.
Well, they didn't work in that scenario.
Yeah, in that application.
Yeah.
But all of this to say, so when I'm reading an email that's informing me about the upcoming adventure, these things are flooding through my mind. And I said to Peter before we turned the camera on, what I was gonna say, and that's why it made me get the camera. I was gonna say, maybe I could be brave if I think of it like I am going to document this so that it's less scary and unknown for the next patient. That's what I was gonna say to myself. But the reality is, what I'm saying is, okay, so I'm gonna go in there. I guess they're gonna cut me open, do something. They're gonna try tugging on a wire probably, I'm guessing, to strip the line. I have no idea, I can't get through to them. And then what? I'm gonna be half conscious and they're gonna say, actually, we're gonna dig it out of your chest now. And then I just sit here and go like, I don't know how I'm gonna process that when my brain's not working. I wonder if it's an option to just...
Part of me wonders if we should just like make a plan to replace it. Like just like, let's not have the trauma of the unknown of like, is it gonna work to strip it and all of that?
Is it not? And so the other thing is like, I would discuss with them, or like I was told in the email that you'll discuss with them the placement of the new port. And obviously I would do that before they give me any sort of sedation drugs. But what if, knowing myself and knowing now that this port placement was so terrible, like I would be very like, it needs to be in the right place. And so what if I'm half medicated and like, wait, do you remember where the port's going to go? But the other side of this, I was saying to Peter, is like, it could be that I get there and there's a really kind, compassionate worker helping me and I'm feeling cared for. I am relaxed from the medications, which are doing their job, what they're supposed to be doing. The people are gentle and they do what they have to do. And if I feel scared, that person who's always like right by your head, it's the sweetest thing. Somebody's like, I don't know if it's the anesthesiologist, but they like rub your head. It's so sweet.
Probably like the anesthesiology nurse.
Yeah. And then they're gonna do it, and I basically faced my fear, and there we go. I talked myself through it. It's gonna be great. And then I think about other parts of it where I'm like, or it's like one of those nightmares where you're trying to run and your legs are twisted, or you're trying to yell and your voice is so hoarse you can't yell and nobody can hear you or nobody can understand you.
Yeah.
I think by the time that this video comes out, it probably will already be all done. So you know what I'm gonna do? I am gonna insert a clip at the end of this and tell you how it went. Okay, a few weeks later, and I have had a port study. We have more thoughts. We will update you as those videos come out. Thanks for being on this journey with us. What a journey. It's all gonna be okay.